Hello, Dr. Stern. I have great pleasure in interviewing you. Now, Kate is head of endocrine and metabolic services at the Women's Hospital and also clinical director and head of clinical research at Melbourne IVF. She's a fertility specialist, a very busy fertility specialist, and she has a special interest in medical fertility preservation and has established and coordinates fertility preservation services at both the Royal Women's Hospital in Melbourne and Melbourne IVF. Now, I'm wondering, Kate, if you can talk to us about your this area and your interest in this area.
Well, Ruth, you and I go back a long time, and we've shared an interest in patients, both in terms of patients who have active cancers and trying to preserve fertility for the future, and then also trying to help them get pregnant once they finish their fertility, once they finish their cancer treatment, often chemotherapy and radiation. And it's just one of those amazing areas, really, where these are patients who are sort of acutely in need of fertility preservation. Over the last 20 years, we've sort of gone from patients referring themselves or being referred by their relatives to actually now finally getting them referred by their cancer doctors, because with 80% survival for patients under the age of 40 overall from cancer, fertility and having a baby of one's own is a really important aspect to ongoing life. And so there's a lot that we can do before patients start their cancer therapy. And then after they finish their cancer therapy, we have, and you and I have shared this interest, very keen to try and ascertain for patients what sort of ovarian function they have. Often we know that cancer treatment can really damage fertility, sometimes permanently, but sometimes there'll be a temporary loss of ovarian activity. It'll be like an early menopause, but the ovary will reestablish itself with time. But unfortunately, usually it's still going to have, these patients are going to have early menopause later on. And you and I have done a lot of work together trying to coax ovarian activity for patients who don't have any after their cancer treatment. And we both know what it feels worthwhile, and it's sort of, I feel it's perhaps the biggest value of the work that I do.
It's been a remarkable area to work in. I've really enjoyed working with you and with the patients in that area. So apart from patients with medically induced infertility, what other areas or what other conditions do you think respond well, or have you noticed respond well to natural therapies?
Well, I think premature ovarian insufficiency itself, which means, all semblance of an early menopause, is one of the most difficult areas to manage in my field and yours, both with respect to establishing a cause and to try and coax some ovarian activity. I sort of see it that in some patients, it's like the ovary is shut down, like the eggs are locked rather than not then there aren't any eggs left. And so I think this is probably the most challenging area that we work in, and one where I think naturopathy really is such a prominent role in trying to establish for patients some recommencement or sort of zhuzhing up the ovary or trying to get some ovarian activity. And I know that you were always very interested in diet and used to talk about high protein diet and the use of Primula and Tubulus and some other naturopathic regimens, which I don't really understand. And, you and I talked about doing a trial, and I think this is an important point. Patients who have premature ovarian insufficiency can get resumption of activity at any time, 5 to 10% per year. And so if I'm giving them a little bit of estrogen or trying some little injections or something, or we're giving them Vitex, we can't always say it's cause and effect, but we can all be happy and revel in it. And I have to say that there are very few options in conventional medicine for young women with premature ovarian insufficiency. It's a devastating condition, often familial. And I really see that naturopathic assistance is so vital. Another area that I think is really important in terms of the collaboration with natural therapists is patients who have dysfunctional cycles. And, you know, not necessarily polycystic ovarian syndrome or high prolactins, you know, they're sort of biochemical conditions, but patients who have irregular periods or have very heavy periods and or very light periods, and being clear that the heaviness of a period doesn't relate to the strength of an ovulation. I think that the treatments that natural therapists offer, judicious use for people that are trained in this area, because they're quite powerful, these medications. So it's important to do this properly and with good understanding. And I know that you've been a great mentor to so many naturopaths in this area. I think that regulation of the menstrual cycle is another important area. I guess a third area, and it's not really so much what we do, but maybe more in reproductive endocrinology, is also PMS. PMS is different, means different things to different people, but it can really be devastating for some of our patients. They just can't function.
Mm.
And, you know, it's a very real thing. And it's not as simple as the estrogens this or the progesterones this. It's so much more nuanced. And that's another area where I find natural therapy is really incredibly helpful.
Mm. Mm. And we also did some work at some of those clinics on PCOS. That was a lot of
Yes.
fun. That was good.
Yes, I think, you know, I've worked in this area of PCOS for now 25 years, and I'm probably more confused than I was at the start. But I think, yes, PCOS is another area. PCOS is difficult, isn't it? Because you have some patients who have low estrogen type PCOS and some patients who have high estrogen. And we're getting more and more understanding of the metabolic basis of PCOS and the
Mm.
insulin resistance. But you're right, that's another area where I think naturopathic assistance is really fantastic. And can I just say that also, to me, one of the things about naturopathy is in the great professionals that I deal with, mainly who, you know, you and your colleagues, is the holistic approach to the patient. And I think that that's, and to be honest, you know, I've seen, you know, you are often all things to all patients, counselor as well,
Yeah.
you know, nutritionist. But
Mm.
in all seriousness, I think the naturopathic approach to patient care being much more holistic than our care. Well, we aim to be holistic, but I think that that's a really important aspect, and that's why it works so well to collaborate together, because there are things that we're just going to miss out on or we won't pick up on, and you know, maybe it's vice versa. But I think that the naturopathic sort of holistic approach to patient care is very, very valuable.
Yes, yes, I agree. And our talk is on unexplained infertility, and that's often requires a holistic approach as well.
Yes. Would you like me to talk about?
Yes, yes.
So unexplained infertility means unexplained by us. You know, it
Mm.
doesn't mean no infertility. It just means the things that are beyond our very sort of somewhat simplistic tests. And the tests that we do, you know, look for ovulation and check that the tubes are open and check that there is some sperm. But we don't know about sperm egg interaction. We don't know what's going on in the uterus. We don't know what's happening at a level of implantation. And so unexplained infertility, it's a bit of a hodgepodge, but it's so complex, really.
Mm.
And it's sort of, you know, I guess it's sort of in a way like saying someone's got irritable bowel syndrome. I mean, that we just, you know, it's just where we end up when we've done our tests and we've excluded other things. And yes, I think that unexplained infertility means we've got to look at it from all angles. You know, we've got to
Mm.
look at
Mm.
psychology, we've got to look at nutrition, we've got to look at exercise, we've got to look at, you know, vitamin and mineral health. We've just got to look at it in so many different ways. And that's why I think the naturopathic approach with its holistic approach is so important.
Yes, yeah. That is great, Kate. Thank you so much for spending time chatting with me. It's been wonderful. Thank you.
Nice to see you.